Leave a little bump over here and here. I test you on it because you're going to see this in practice. It's common enough that you can encounter this, and I don't want you guys to look like a fool and refer this patient to a gastroenterologist or hepatologist or something crazy and saying there's a mass in the liver, right? It's just a congenital anomaly. There's no symptomatology associated with it, nothing. We had a student that I happened to see a few years ago. She had eventration, where the whole diaphragm was much higher on the right side, and everybody was freaking out, and I'm like, that's just eventration. She was asymptomatic, right? It was just part of her thoracic spine series in the clinic. You saw it. Okay, so diaphragm, keep going though. Anybody else see? There's one more finding, one more test question.
Is it another posterior ribs?
So full inspiration?
No, he wasn't.
Well, let's see. So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 above the diaphragm. So yeah, that's full inspiration. The trick is to get a first rib up here, and then the second is right underneath it. Yeah, it's hard. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Young lady?
I was what I was gonna say.
Yeah,
It
okay.
didn't look like it was enough posterior ribs, but I didn't see the first one up there.
Yeah. Oh, yeah. So check this clavicle out. Can you see how he's positioned a little strange? So there's many different ways of shooting a chest X-ray. Some techs like it this way, some like it this way, some like it this way. God knows what they did with this guy, right? Maybe they had to tie him down, I don't know, but it just look a little funky, doesn't it? What's darker? Oh, you're right.
Is that just thinking from?
It's rotation. Yeah,
So.
no. No, I think the history of lung cancer is like a red herring. I'm not, because if he truly has had lung cancer and he's been treated for it, first of all, if it was radiation, we would see radiation fibrosis. If it wasn't radiation and they cut it out, we'd see a whole bunch of clips around and broken ribs and sutures and whatnot left over. So I think that's just a red herring. But you are correct, though. This lung field looks a little more loosened. And as a typical radiologist, I'm going to say, oh, it's rotation. You know, that's the way to get out of stuff. I think it's rotation. So keep going. There's one more finding. The patient's left? Yeah, very good. So we have a granuloma. So when we see these granulomas, and if they're in the hilar area and they're calcified, they're done. It means we're happy. It's not active disease. When things in the chest calcifies, we're happy because it means it's no longer active. It's different in the abdomen. If you have calcification there, it's gallstone, kidney stone, plaquing, whatever. But if it's in the rib cage or chest